Welcome to the Washington State Department of Enterprise Services Local Government Self-Insurance Programs Self-Insurance Portal. The Self-Insurance Portal, or SIP, is used to collect annual report information from local government and nonprofit joint self-insurance programs and risk pools. Programs can use the portal to easily enter required financial information and upload documents into our database. SIP helps programs manage their workload by sending frequent reminders for all the important dates and reporting tasks, including when reports are due. It will also remind you to submit audited financial statements at the appropriate time. SIP will keep the history of important contracts and documents that have been uploaded for future reference as well. Let's get started. The login page for the SIP can be found on the DES website, but you'll also receive an email with instructions for setting up your own login username and password. Once logged in, on the home page you'll notice there are three main areas: Resources, File Annual Report, and View Past Reports. Also, at the bottom of each page, there's contact information should you need to get in touch with the program administrator for help. The Resources button will take you to the DES site and covers all the relevant program information and documentation requirements. The File Annual Report button is where we'll spend most of our time. And View Past Reports is a read-only history of your completed reports from years past. Let's file an annual report. After clicking Enter Update Annual Report, you'll be taken to the report form. Notice there's two buttons at the bottom of the page: Cancel and Save and Exit. Cancel will take you back, and any data input up to that point will be discarded. Save and Exit saves your work in progress so that you have the option to return to the form later if you don't have all the information readily available now. In the Program Information section, note any changes to your program that have occurred in the past year and any changes anticipated for the coming year. Enter the balance forward amount, the average number of employees, required if medical is one of the benefits offered in your program, and the average number of dependents. Next, indicate whether the reserves will be in a separate account or in the general fund. The next section will vary depending on the specific benefits offered in your program. In this example, all the benefits are present. In this section, indicate if there's an actuarial estimate for each benefit type, and if there is, enter the estimated claims liability amount for each. You may insert an actuarial estimated amount for the outstanding liability as of fiscal year ending, which would then be supported by the actuarial report that you will be required to upload. Otherwise, the system will default to the regulatory requirements. Those requirements are 8 weeks of program expenses for all programs except medical programs. For self-insured medical programs, the standard reserve amounts is 16 weeks of program expenses with an additional stop-loss policy which pays 125% of expected claims. Overall, if the actuarial estimate is entered, then the ending reserve amounts are compared to the actuarial liability estimate you entered as of fiscal year ending. Otherwise, the reserve amount at fiscal year ending will be compared to the standard 8-week reserve or 16-week reserve for medical expenses. In the financial section, this is where you enter all the combined revenues by their source, such as employer contributions and employee contributions. Last, we come to the combined expenses section. This section requires that the claim payments are entered for each applicable benefit type, but it allows the expenses to be entered one of two ways: either combined as one amount or itemized by benefit type. But for any given expense category, you must enter either a combined amount or an itemized by benefit type amount, but not both. Next, I'll click the Upload Documents button next to the same annual report. The list shown will guide you as to what documents, if any, are required and what documents are optional. In my example, I have 2 optional documents and 1 required document. The actuarial liability report is required because I filled in the actuarial estimate. Click the Browse button. Browse. Once you've uploaded the document, the name of that file will appear in the status column. If you're done uploading documents, you can click Exit. The last step is to submit your annual report. Don't submit until the form has been completed and you've uploaded all the required documents. Once submitted, you will not be able to make any changes. After you submit, you should see this message: submitted for approval successfully. And you're done. Remember to do all 3 steps for each of your annual reports that are relevant for your program. Thanks for watching. Remember that if you need support, we are here to help. Contact information is on the bottom of every page. Thank you.